Good day wherever you are. This is the Cindy Show with your beautiful host, Cindy Official. As we all know, October is the month of breast cancer awareness, and today we are shining spotlight on how you can protect yourselves and your loved ones against breast cancer. And on this episode today, I have Evette Sefah-Debrah from the Chosen Hospital and Fertility Center, who will guide us through the vital process of breast cancer examination and most common misconception. So join us on this episode as we are going to have an educative and insightful conversation. Welcome to the Cindy Show.
Thank you.
It's good to have you here.
Same.
All right, so let's start with breast cancer itself. What is breast cancer?
Well, before we delve into breast cancer itself, there are petty things you should know before the cancer itself. First, if we talk about cancer, it's any abnormal growth. So we are now focusing it on breast since you're in the October month. So any abnormal growth in the tissues found in the breast, that's all we can say is breast cancer. So first, we are not saying immediately you come to the hospital, you are going to diagnose you of breast cancer. There are a lot of things that we go through before we can say that you have breast cancer. First, with a lump growing in your breast, it doesn't necessarily say that you have cancer. There are other investigations that we go through before we can say that you have breast cancer. So you go through screening, you take your history, you go for laboratory findings, we do ultrasounds, and then we take you through treatment. So with the cancer too, we have two types. You have the benign and the malignant. So the benign is just like a small growth. Mostly it doesn't spread. And then we have the one that spreads. So you can have breast cancer, but then it wouldn't be cancerous or it wouldn't grow or spread quickly. So we have two types of breast cancer. We have the smaller growth, the scientific name being a benign, and then the big one that spreads quickly.
So the difference between the one that spreads quickly and then the one that doesn't spread quickly is what?
They are all cancerous. One is benign, meaning one is small. It just started developing into a cancer. And then the other one, it has grown into a cancer and it's spreading across, even spread and goes to your lungs, your heart, the other part of your breast. And then that's when you can go through a surgery to take that part of the breast off. That's the mastectomy. So the cancer is two types, as I said. The smaller growth and then the one that spreads.
So does it mean that the smaller one is not disastrous? Because you said one is not cancerous.
Yeah, so early detection is what is important. If it's detected early and it's taken out, it wouldn't spread. But if it's late and then already growth has started taking place, then maybe you have to take the parts of the breast off or maybe everything off. So it depends on the growth of the cells or the cancer, the cancer cells.
So what are some of the symptoms, early symptoms of breast cancer?
I wouldn't want to channel the conversation to breast cancer.
Okay.
So first,
what are we discussing?
We are discussing about breast cancer, but there are things that you would see that would prompt you that something is wrong with your breast, not necessarily cancer.
Cancer, okay. So you mean to say it's not anything that is wrong with your breast, which is a cancer?
Yes.
Okay.
And secondly, there are symptoms and signs that you see, you understand, that would alarm you that you are getting the cancer. So for instance, when you see a growth in your breast, we call it a lump. That growth is not cancerous unless it's taken out and investigated upon before we can say that it's cancerous. So any growth in your breast is not cancerous. So
please let me come in with the growth. What do you mean by the growth?
Okay, so when we take our breast, we have something hard in our breast. We call it a lump. That's what we all say, it's a lump. But when you examine your breast, it doesn't move.
Okay.
It contains the lobes that produces breast milk and the milk that. But then we are saying that there's going to be an extra growth. That's when you touch, it moves. It comes with pain. And sometimes the color around your breast changes. That growth is what we call a lump. So we are saying that when you see that lump in your breast, we are not saying you have breast cancer. You come to the hospital and then we take it from
take
there.
a check. So how often do you think we should go to the hospital and then check on our breast?
I would say there's no need for you to go to the hospital for your breast to be checked often.
Okay.
Every month as a lady, 3 to 5 days after your menses, that's when your breast becomes tender and the pain is gone down and the heaviness is gone down. Personally, you can examine your breast. Often, you can come to the hospital to be examined, but then in Ghana and some parts of the world, October is set aside for those things. So you can come in the month of October to the hospital for your breast to be examined. But then apart from October, you can do the self-breast examination yourself. Yeah.
So how do you do it? Can you demonstrate to us?
Sure, why not? So, the breast examination, it has 3 steps. I don't know if I can.
Yeah, you can stand up.
Okay, so before, as I said, the age you can start examining your breast is from 20 years going. So when you're 20 years, we believe around that time you started your menses. So after your menses, that's 3 to 5 days after your menses, you get a mirror. So let's assume there's a mirror in front of me with no shirt or no bra. You look at your breast. It's believed that mostly one breast is quite bigger than the other breast. Not very big, but then you can see the difference. So in front of a mirror, you look at your 2 breasts and then you check the color around the skin color. So maybe I'm dark in color. So my breast, around my breast will be quite dark, but not very darker because it's not really exposed to the sun. So I know the color of my breast. So I'm expecting that every month I should have that same color around my breast and to the side of my armpit. So you're checking the skin color. Now, when you look at your breast, you know that, let's say my left breast is quite bigger than my right breast. So you're checking the size. Every month, my left breast should be a little bit bigger than my right breast. If you see that there's a little change in the right one or a little change bigger than the normal size, you should also know that there's something wrong. So, you know when you're playing an orange or a tangerine, there are little dots around it. Or when an ant bites you, you have this swelling and these dots around. Yeah. So when you look at your breast and you see that there's a portion or a part of that breast that has that dent or swelling around, you should also know that there's something wrong with you. So, and then if there's redness, I know my color, the skin color, I know. So if I see any change in color, maybe there's a little bit darker color or redness around, you know that there's something also wrong. So after you're done, that's the first step, is looking inside the mirror, looking at the size, the color around it, and all that. When you're done, your hand on your waist, you bend down, still in front of a mirror. You look at the size of your nipples. So your nipples are to come out, and mostly when you check, they're of the same size. So they are around. So another month you check and you realize that there's a dent in your nipple, one or both. It means there's something wrong. So when you're done with that also, you can try and raise your hand up and look around to check if there's no swelling or no discoloration around. So that's the second step. When you're done, you lie down. So when you lie down, you can get a pillow to support your back up to your shoulder area. So you lie. So if you want to inspect your left breast, you keep your left hand behind your back with the support of the pillow. And then with your 3 or 4 fingers, you go round. Whilst you are going round with your finger and you are going in a circular motion. Please, you get it?
Yeah, I do.
So with your 3 fingers, you can go round in a circular motion. What are we looking for? Already, I said that we have the milk, that we have lobes in our breast. That feels like a lump. But they are stationary. They are not moving. You are looking for something like a growth. That's when you go round, it moves. It moves. It's hard. Sometimes it's filled with water. So you can actually touch it, feel it, and it moves. It moves from one place to the other. So that's what you are looking for. You go around. You start from your armpit area because the tissues of our breast, they are all found from our armpit area. So you go round, round. Then you change the other place. You do same. When you are done, you can get a tissue or a cotton. You press your nipple to see if there's any discharge going to come out. So that discharge coming out can be offensive. The smell can be offensive. The color might be blackish or brownish. So that should also tell you that there's something wrong with your breast. So basically, that's how we examine our breast. So every month, you do it 3 to 5 days after your menses. And then when you're 20 years, you can start doing the self-breast examination every month.
So that means if you are below 20 years, you cannot examine yourself.
Scientifically, it's proven that age 20, everything is well developed. So your breast is developed, and then you've also started menstruating. So you can see the difference, because when you're menstruating, your breast feels full and heavy. So after, you can do that.
So anyone below 20 years, if you want to examine your breast, you have to go to the hospital.
It's believed that before you can get breast cancer, you are 40 years and above.
40?
Yes, that's when most women are diagnosed with breast cancer. So now around 20 years, you are doing this to just see the lump and the changes so that the lump will be removed. I had a story, a woman was around that age. She got a lump, she played with it. 10 years later now, she had breast cancer because it was benign, it was small, and it was growing. It was just a lump, but it wasn't cancerous. She didn't take it so serious, and then it grew and grew and grew, and now she saw all the symptoms we were talking about, the redness and all that. So around the age of 20, you can get the lump. You cannot see all the symptoms, but then the lump will alarm you that there's something wrong with you. The lump doesn't mean it's cancerous. So just go and let it be removed.
Do you understand? That is what they mean by early detection saves life. So yes, if you see it early and then they remove it, that will be the end. You mentioned that 5 days or 4 days after your period. That is
3 to 5 days.
3 to 5 days after your period. So if you do it before your period or you do it within your period, you're not going to get the exact result that you want.
It's believed that before our period, you ovulate.
Yeah.
And then we have some hormones called estrogen that helps in ovulation. So far from menstruation, anytime you're menstruating or you're ovulating, the same hormones that help in menstruation are the same hormones that are found in the breast. So some people go like, oh, I feel pain in my breast, and sometimes when I press, I see this clear fluid. That's time you're menstruating. And I'm saying that examine your breast when you feel pain, there's something wrong with you. So we believe that 3 to 5 days after your menses, those hormones have weared off. So you don't feel any pain, you don't see any discharge. That's when you can get a correct outcome of the examination.
So what about a discharge that looks milky or colorless. You know, there are some discharge, it's colorless like water or milky, because you made mention of brownish or reddish discharge. So what about a colorless or a milky discharge?
A milky discharge is maybe when you're breastfeeding or something. And if it's colorless, as I said, the rise and fall of your hormones before and after menstruation causes your estrogen level to make your breast produce a little fluid. That fluid is clear. So it's normal. If it's before your menses, it's normal. But then if you realize that after your menses, it's still there, it comes with the milky color, you've not given birth before, with the heaviness and the pain, you have to go and see a gynecologist. Maybe there's an hormonal imbalance or anything, something wrong with you. Yeah.
So do the size of your breast indicate or it poses a chance of you getting breast cancer?
No. The size of your breast doesn't say that because your breasts are big, you can get. It's a misconception and it's not true. The smaller breasts are those who rather get a lot of cancer cases.
Really?
Yes. Throughout this month, all the screening we've gone to, we observed that those with the smaller breast are those that we even find bigger lumps inside. So the size of the breast doesn't really determine you getting cancer. It's the tissues, it's the cells. So if there's any abnormal growth of the cells, whether it's found in a big or smaller breast, it will grow, it will form a lump.
So what is the main cause of breast cancer? Is it genetic, or it is from something that you do, like your lifestyle or what you eat and all of that?
Okay, so the main cause of breast cancer is not known. The cause of cancer is not known. Any form of cancer is not known. But we have risk factors or things that when you do, it can expose or prone you to getting the cancer. So some of the risk factors we say are genetic. In case your auntie, your mother, or your grandmother, or any female member of your family has died out of cancer, especially breast cancer, it means you are prone in getting it. You have a chance in getting breast cancer also. And then our lifestyle, the way we live, we go to work, we sit in our car, we go back home, we eat late in the night, we sleep, we eat processed food, canned foods, and all those things. It's said that one of the causes, the risk factor, is our lifestyle and the way we eat and all that. So if you don't exercise, you don't diet, you don't go to the gym, you don't walk and all that, it can also risk you in getting cancer. And also age, as I said, mostly age 40 and above. You know, around 40 years, your cells are worn out, they are getting weak, they are getting tired. So those people are also at risk of getting breast cancer. And then hormones. There are some people, they go like, oh, I don't want to marry now. I want to marry at the age of 35, but I have a boyfriend, and then we are having unprotected sex. I don't want to get pregnant. So they intend taking hormonal drugs like going for 3 months injections so that they don't get pregnant, or they'll be taking pills that are not prescribed by a doctor just to prevent them from not getting pregnant. Overdose and continuous use of those hormones can also risk you to getting breast cancer. And also mothers who do not breastfeed their babies. So if you give birth, when you give birth, your breast starts producing milk. And then it's believed that the milk is supposed to come out and feed the baby. If you don't breastfeed your baby, and then you go like, oh, you don't want your breast to fall, or you don't want to breastfeed your baby, you want to use breast pump always and all that, the milk that might get blocked, and then you can get an infection. That infection, if not treated well, can cause cancer. So some of the risk factors are what
I've heard that so many people abroad, they don't breastfeed their children. How true is that?
I don't
Because
have any
if they
scientific...
don't, then they should be at higher risk of getting breast cancer.
So as I said, it's a risk factor.
Okay.
I'm not saying that because you don't breastfeed, you get breast cancer. There can be other things added to it, like genetic, your lifestyle, hormonal therapy, and all that. And then you don't breastfeed also, infection. Then you can get breast cancer. I'm not saying one particular thing can lead to you getting
The
breast cancer. Yeah.
Let's go back to the contraceptives. You made mention that contraceptives can pose a factor.
Yeah.
Do you mean to say contraceptives like Lydia, Postino 2,
Okay.
and those?
So I said hormonal contraceptives. And I didn't really...
You didn't specify this. You
Yes.
made mention of the injection.
Yes.
But I want to know if Lydia, Postino 2, and the rest are also inclusive.
If they are hormonal and then you abuse them, there's a tendency of you getting cancer.
Can you explain the hormonal?
Hormonal, okay, we have hormones in our system. It comes from our brain. So the common hormones female we have is the estrogen, and then progesterone. So the hormonal that mostly we take in is progesterone. So the Lydia, the
Postino 2,
all those things, they contain progesterones. But then our body is structured in a way that we have the luteinizing phase in the follicle stage. So progesterone works, goes down, and then estrogen will also work and come down. So they alternate. So if you take higher dose of one, you are confusing the other one. Please, do you understand? So taking higher dose of progesterone won't make your estrogen level also work. And we are saying that it confuses the cell. The cell is what causes the breakdown, abnormal growth of the cells is what is causing the cancer. So now you're confusing the cell. It's just an imbalanced thing. Imagine supplying power to something continuously, even in a tube, pouring water in one tube continuously. What will happen to it? It's either it enlarges, when it can't take it, it will burst. So the cells will become confused, and then the wearing on and off and all that, it ages, it gets tired, it stops working and all that. We are saying it's a risk factor. We are not saying that because there are people who have PCOS, and then those people who have PCOS are treated with hormonal drugs. That we've given them a time to take it. We've given them a period of months to take it. So it's regulated depending on their weight, the number of doses they are supposed to take, and all that. But this hormonal drugs, it doesn't have weight given to it. When you remember Lydia, do you check your weight before taking?
No.
You take all the 2 or you take all the 1. With the injection, you go for every 3 months. You have to go for the injection every 3 months. Whether you are gaining weight, whether you are losing weight, you are just taking it. So, but then the PCOS and all those people, the hormonal drugs are measured and given to them a specific period of time. At that time, they stop. They don't continue taking it. So it's just abusing and the hormonal drugs that can get you.
I think what you are saying is 100% right, because the Lydia, the Levon 2, Postino 2, all those contraceptives that they said that you should not take it more than 3 times in a year. So just like what you are saying, if you take it consistently, it's kind of...
It causes an imbalance with your hormones.
So it makes sense. You should not take it regularly. If you take it once, you should even be taking it once in a year. You shouldn't take it more than once because you get breast cancer. So let's continue. They say men do get breast cancer. How true is it?
It's very, very true. Men are also at risk of getting breast cancer because they have the breast tissues also. So they are at risk of getting breast cancer.
But it is not as high as for
women.
Yes,
because women, we have a lot of fatty tissues. That's what gives us the size. So men do have breast tissues, but then it's not that a lot. And then it doesn't produce any milk and all that. So they are not at so risk of getting this. But provided they have the breast tissues, they are at risk of getting it also.
So can they also examine themselves?
Of course, they have to go through the 3 steps. So they look at the mirror, they look around the size, also they can go down. Especially the men with a lot of fat, a little bit fat. When they bend, they can see their nipple and all that. They have to lie and examine it also.
Oh, okay. Let's talk about this. They say continuous wearing of bra, or let's say wearing bra for a very long period of time. You wear a bra from morning 7 o'clock a.m. to 9 o'clock p.m., that it poses a higher risk of getting breast cancer. How true is that too?
Scientifically, there's no proof to that. There's no proof that you wearing your bra for long can cause breast cancer. But then, you know that mostly the bra has this metal or metallic stripe around it.
Beneath.
So maybe wearing it for so long can be pressing on the tissues. But scientifically, there's no proof. So maybe that's the reason why they are saying that. So they are just saying it so that you don't wear it for long to damage your tissue. And when the tissues are damaged, you can get breast cancer. But scientifically, there's no evidence.
Earlier, you mentioned that women who do not breastfeed stand a higher chance of getting breast cancer. So do you mean that breastfeeding lowers your chance of getting breast cancer? Yes.
As I said earlier on, I was saying that there's no cause for breast cancer, but then there are risk factors. And then one of the risk factors is when you do not breastfeed your children. So I'm saying that because we have a milk duct and we have loops that produce the milk. And then if you've observed someone who has given birth before and the person is not breastfeeding, you can see that the breast becomes engorged, very hard. I don't know if you've seen some before. Very hard, very painful. You can even see the veins and nerves around the breast out. It's very painful. And that's if you don't take care, it becomes infectious. So if it becomes infectious and it's not treated, you are at a risk of getting the cancer. So it's just one of the risk factors. That's why we encourage breastfeeding.
All right, so what happens that the mastectomy happens? What leads to the mastectomy?
So before mastectomy means removal of the breast
Completely.
yes, or a part of it. Ectomy means removal.
How do you remove part of this?
So I said, in case you come, we detect that you have a lump and then it's growing and spreading across the tissues in your breast. We have to take it out. So when we take the lump out, we send it for further investigation. So we realize that now the lump taken out is cancerous and it's spreading rapidly. We have to take away all those cells around where the lump was found, else it will spread across the breast. And then the closest organ to your breast is your lung, then your heart.
Your lungs.
Yes, your lung is closer to your chest. That's your rib cage there. And then, so if you don't take the breast out and the lump spreads or the cancer cell spreads, it goes to your lungs and then to your heart. So mastectomy is removal of the infected breast to prevent the cells from growing. So after the mastectomy, you go through chemotherapy or radiation therapy, where the other cells, the roots of the cells are also killed. Yeah. So you remove the breast to just prevent the spread of the cancer cells.
All right. So if right now my right breast is infected with cancer, can it transition from the right to the left?
Yes, please. So the cells, for a lump to be cancerous, it means it's spreading or it's growing. So immediately you get cancer, it spreads. it spreads, so it can spread, and it's the tissues are connective. They are connected. Everything in our body are interlocked. So depending on where you find them, cells growing and how it's spreading, it can spread across. So as I said, it can spread to your other breast. It can spread to your lungs. It can spread to your heart and even the whole part of your body.
So does it mean that if the cancer spreads to the lungs, it's going to cause cancer in my lungs?
Yes.
But the cancer in my breast is it the same cancer? Is it one cancer that we are talking about here?
So cancer is cancer.
So whichever cancer it is cancer.
Depending on where it is found, then has its name.
Okay.
So it's found in the breast, so it's breast cancer. But when it spreads to other parts, it also causes other complications. So we have lung cancer, we have blood cancer in the blood, we have cancer of the heart, anywhere, cancer of the brain, anywhere. So depending on where the cells find itself and depending on how rapidly it's growing. So when you find it that, it started from the breast, it's spreading, it's going to the other breast, we have to cut the breast that is affected so it doesn't cross to the other breast. Okay, it has crossed to the other breast, but it's not the whole part of the other breast. Some part of it, we have to take that lump out and go and examine. Is it going to spread? Do you understand? So it can spread across everywhere. So you have to take everything out and kill the root of it, else it will spread. That's how dangerous cancer cells are.
So from the right to left to my lungs to everywhere,
Yes.
if it's not detected early.
That's why I'm saying that early detection saves
lives. So immediately you notice a lump, what do you do?
So immediately you notice that you have a lump in your breast. First, don't panic. Be calm. Just go to the hospital. They take your history. You tell them what's wrong with you. Then you go for a scan called the ultrasound or the mammogram to check how the lump is, what is causing the lump. Some of the lumps are just water-filled. Some are just maybe you got an infection and then it filled with a cyst. It's just that you remove it for you and then it will be fine. But if the lump is hard, we'll go and examine it and see if it's cancerous. If it's not, you are free to go. Just remove it and then you live your normal life. If it's cancerous, we'll see how extent the cancer cells are growing. Then if there's a need for radiation therapy or chemotherapy or mastectomy, it will be done. So not all lumps are cancerous. It has to be taken out before we can see that it's cancerous or not.
And not all breast pain is breast cancer.
Yes.
Because the moment someone has a breast pain, it is automatically termed as breast cancer. And sometimes to the discharge.
So funny enough, when the symptoms start setting in, you are not going to see one symptom. You are not going to experience only pain. You are going to see the pain, you are going to see the swollenness, you are going to see the redness, you are going to see the discharge and all that. You can't just say, yes, and you are not going to see that, my breast is paining me, so I have breast cancer. As I said, it can be hormonal. So you can't, based on one symptoms, to say that you have breast cancer.
I have exhausted all my questions. I don't know if there is something that I've left out or there is something that you want to add that I didn't ask you.
Okay, so we've basically said all. Just examine your breast every month. Do it 3 to 5 days after your menses. When you see any of the symptoms I've stated earlier on, you come to the hospital and then you get tested. Early detection saves life.
Nice.
So when you're detected early, quick treatment saves life. Some people can detect us early, but then they don't really go through the right process to treat it. So early detection, quick treatment can save your life.
Let me ask this. Is the treatment of breast cancer expensive? Because in Ghana, most of these cancers, they are very expensive. So is it expensive?
Honestly, treatment of breast cancer is very, very expensive. It's very expensive. Because for you to go for the scan, it's money. The medication I'm told is quite expensive. Chemotherapy is done for 15 minutes to 30 minutes. It's expensive. You have to eat well.
Chemotherapy, is it weekly like the kidney?
It depends on the extent of the cancer cells, the growth of it. So the one I know, she had a lump 10 years ago. She didn't really pay attention to it. 10 years later, she started seeing the redness, the pain, the dipping of the nipple, the discharge, brownish discharge. It turned into red discharge, and then they had to remove it. So the surgery itself is expensive. After the surgery, you have to go and examine the lump. It's expensive. The medication, post-op medications are expensive. Medication to kill the cancer cells are expensive. The chemotherapy and the radiation therapy too are very, very expensive. And even whilst you are doing the radiation and the chemotherapy, yourself, you go through changes. You'll be vomiting, you can lose weight, you can lose your hair and all that. And you have to also take care of yourself also. And then this chemotherapy are radiation or chemicals to destroy cells. If you don't take care, they are going to destroy the already real cells too. So it's very, very, very expensive. So when you see a lump, just come, let's remove it and be free.
So right now, I want you to encourage them to screen themselves regularly or go to the hospital frequently, because this breast cancer treatment is very expensive.
Okay, so WHO says that every minute 4 women are diagnosed with breast cancer. Every minute 4 women are diagnosed with breast cancer. So I don't know how severe you want me to sound this to you.
That means in an hour.
So 4 women every minute. So 60 minutes is 4 times 60. Yes, in the world. And then we are saying that 4.5 million women die out of cancer every year.
That one is not stated whether breast cancer or breast cancer.
Yes. 4.5 women.
And we have to take this very seriously. Yes. I don't remember the last time I self-examined myself.
So please,
first year in the uni.
So every month, please examine your breast. Know your breast. There's a saying that your partner, men, sucking your breast or holding your breast.
Yes, I forgot to ask you that you should suck boobs. It helps. How true is that?
It's a myth. It's not so true, or it's not scientifically proven. But then, as I said, you stand in front of a mirror, you examine your breast, you know your breast size. So your partner, who always fondles with your breast, who always holds your breast, knows how your breast is, knows how your breast size is. In case he sees any changes, it can be able to tell you. And so like, oh, I said maybe there's something here, or today when I was drinking it, something entered my mouth. It doesn't taste nice. It doesn't smell nice. When I checked, it was brownish. It was reddish. So the men would see the changes, but scientifically, they don't do anything to prevent you from getting the cancer.
So they've been lying to us.
Oh, they know the size, they know the breast, they know everything, so they can help you to see the changes. But
so basically, you people have been lying to us that sucking our boobs, holding it, will prevent us from getting breast. It's never true. It's never true. Our madam is here. She said, you know the way it is.
Yes.
So maybe if there is a slight change, you would be quick to notice.
Yeah.
But then you holding it, you touching it, has nothing to do with breast cancer.
Yeah.
So are we done?
Oh yes. So the good news is that my facility, we are offering 20% discount to anyone who sees a lump or wants to be screened to come. So the Chosen Hospital and Fertility Center Limited is right at Titigu. In case you see any growth, you see any lump, or you see all the symptoms I've stated, don't rush, be calm, just come, and we'll give you 20% discount off just for the month of October. But any other month, you can come and get screened. Our doors are open. And when you come now, we can screen you for free. There's no need for you to pay for anything. Thank you.
So that means I should come. You see, myself and my guest, we are both celebrating Breast Cancer Awareness Month. We are both in our pink earrings. As I promised earlier, we are going to have an educative and insightful conversation. And then, of course, we've had an educative program. She has discussed what breast cancer is, right? How you can self-examine yourself. So right now, you know how you can self-examine yourself. You know when you see a lump, you know what to do and all of that. So thank you for being my guest, and I hope you've all enjoyed this conversation. Thank you for making time to watch us. If this is your first time, kindly subscribe to our YouTube channel and do follow us on all our social media platforms. Thank you. See you next week.